Dysphagia screening. The purpose of this presentation is to provide guidelines for screening adult patients for dysphagia. A standardized approach to dysphagia screening will lead to positive patient outcomes, such as decreased aspiration risk and related complications, decreased time a patient with normal swallowing is kept NPO, and decreased length of stay by early identification of dysphagia. Dysphagia screening can be accomplished using a three-step process. 1. Determine the patient's risk for dysphagia based on the patient's health history. 2. Determine if it is safe to administer water based on the patient's current clinical condition. And 3. Perform an assessment of the patient's swallow function with a water swallow test. A patient should not have anything by mouth, including oral medications, prior to a dysphagia screening. A summary of risk factors for dysphagia is listed here for your review. During the water swallow test, assess for signs of dysphagia or aspiration, such as wet gurgly voice and/or cough, throat clearing, spillage of water from the mouth, or water being held in the mouth.
The water swallow procedure is a three-step process. In step 1, you give 5 ml of water in a medicine cup to the patient and assess the patient for any difficulty in swallowing. If there is no difficulty, then move on to the second step, which is administering 20 ml of water in a medicine cup. Again, look for any difficulty in swallowing. And if the patient continues to have no symptoms or signs, then move on to the third step, which is administering 90 ml or 3 ounces of water in a drinking cup, and then look for any signs of difficulty in swallowing. Now, at each of these steps, if there is any difficulty in the swallowing, if you see any signs of difficulty in swallowing, immediately you have to stop the process. And at the end of the test, whether the patient passed all 3 steps or failed, you have to inform the provider and you have to document it in the patient's chart whether the patient passed the test or failed the test.
If a patient's dysphagia status is unclear, keep the patient NPO, including oral medications, until dysphagia status can be ascertained. Remember to be mindful and tell the patient and family the indication for the dysphagia screening, the results of the water swallow test, and the rationales for keeping the patient either NPO or given a pureed diet. If a patient who has previously passed but later has a decline in clinical condition, rescreening is indicated. In a patient who has previously failed, rescreening is dependent on individual site training and the availability of the speech-language pathologist.